Hey Debbie, I am going to be doing cardio questions that we didn't cover before, and I'm starting with Lippincott on page like 328. And starting with question, I'm just doing like the ones that aren't really highlighted. So let's do number 10. A 60-year-old comes into the emergency department with crushing substernal chest pain that radiates to the shoulder and left arm. The admitting diagnosis is acute myocardial infarction. Admission prescriptions include oxygen by nasal cannula at 4 liters per minute, complete blood count, a chest radiograph, 12-lead EKG, and 2 mgs of morphine IV. The nurse should first administer the morphine. Okay. I missed some. Okay. 20. Which of the following is an expected outcome for a client on the second day of hospitalization after an MI? The client can perform personal self-care activities without pain. 21. Which of the following is an expected outcome when a client is receiving an IV administration of Lasix? Increased urine output. Sorry. 24. After MI, the hospitalized client is taught to move the legs while resting in bed. The expected outcome of this exercise is to prevent thrombophlebitis and blood clot formation. 25. Which of the following is the most appropriate diet for a client during the acute phase of MI? Small, easily digested meals. 27. Which client is at greatest risk for coronary artery disease? A 65-year-old female who is obese with an LDL of 188. Let's do this one. 28. A middle-aged adult with family history of CAD has the following: total cholesterol 198, LDL cholesterol 120, HDL 58, triglycerides 148, blood sugar 102, and C-reactive protein 4.2. The healthcare provider prescribes a statin medication and aspirin. The client asks the nurse why these medications are needed. Which is the best response by the nurse? The answer is the CRP is elevated, indicating inflammation seen in cardiovascular disease, which can be lowered by the medications described. The client has been managing angina episodes with nitro. Which of the following indicate the drug is effective? Decreased chest pain. 30. If a client displays risk factors for coronary artery disease, such as smoking cigarettes, eating a diet high in saturated fat, or leading a sedentary lifestyle, techniques of behavior modification may be used to help the client change the behavior. The nurse can best reinforce new adaptive behaviors by rewarding the client whenever the acceptable behavior is performed. 34. Prior to administration of TPA, the nurse should assess the client for which of the following contraindications to administering this drug: history of cerebral hemorrhage. Molly. Oh my God, stop it. Sorry. 39. Following diagnosis of angina pectoris, a client reports being unable to walk up 2 flights of stairs without pain. Which of the following measures would most likely help the client prevent this problem? Take a nitroglycerin tablet before climbing the stairs. 40. The client who experiences angina has been told to follow a low cholesterol diet. Which of the following meals would be best? Spaghetti with tomato sauce, salad, and coffee. 41. Which of the following symptoms should the nurse teach the client with unstable angina to report immediately to the physician? A change in the pattern of the chest pain. 45. As an initial step in treating a client with angina, the physician prescribes nitroglycerin tablets, 0.3 milligrams given sublingually. This drug's principal effects are produced by vasodilation of peripheral vasculature. 46. A client has a throbbing headache when nitroglycerin is taken for angina. The nurse should instruct the client that acetaminophen or ibuprofen can be taken for this common side effect. 47. How should the nurse instruct the client with unstable angina to use sublingual nitro tablets when chest pain occurs? Sit down and then take one tablet, and if pain persists after 5 minutes, call 911. 251. A client with chronic heart failure has atrial fibrillation and a left ventricular ejection fraction of 15%. The client is taking warfarin. The expected outcome of this drug is to prevent thrombus formation. 58. In which of the following positions should the nurse place a client with heart failure who has orthopnea? Sitting upright with legs resting on the mattress. 60. A client with heart failure is receiving digoxin intravenously. The nurse should determine the effectiveness of the drug by assessing which of the following: increased myocardial contractility. 61. Furosemide is administered intravenously to a client with heart failure. How soon after administration should the nurse begin to see evidence of the drug's desired effect? 5 to 10 minutes. 62. The nurse teaches a client with heart failure to take oral furosemide in the morning. The primary reason for this is to help prevent sleep disturbances during the night. 63. The nurse should teach the client that signs of digoxin toxicity include which of the following: visual disturbances such as seeing yellow spots. 65. Which of the following foods should the nurse teach a client with heart failure to limit when following a 2-gram sodium diet? Tomato juice. 67. When assessing an older client, the nurse finds the apical impulse below the 5th intercostal space. The nurse should further assess the client for left ventricular enlargement. 68. The nurse is admitting an older adult to the hospital. The echocardiogram report revealed left ventricular enlargement. The nurse notes 2+ pitting edema on the ankles when getting the client into bed. Based on this finding, what should the nurse do first? Assess respiratory status. 69. The nurse's discharge teaching plan for the client with heart failure should emphasize the importance of doing which of the following: obtaining daily weights at the same time each day. 71. A client has returned from the cardiac cath lab after a balloon valvuloplasty for mitral stenosis. Which of the following requires immediate nursing action? The client has become more somnolent, which means that they're tired. 72. An elderly client with diabetes who has been maintained on metformin has been scheduled for a cardiac cath. The nurse should verify that the physician has written a prescription to withhold the glucophage prior to the cardiac cath. 76. A client experiences initial indications of excitation after having an IV infusion of lidocaine hydrochloride started. The nurse should further assess the client when the client reports having tinnitus. 78. A client has mitral stenosis and will have a valve replacement. The nurse is instructing the client about health maintenance prior to surgery. Inability to follow which of the following regimens would pose the greatest health hazard to the client at this time? Medication therapy. 79. In preparing the client and family for a post-op stay in the ICU after open heart surgery, the nurse should explain that the client will receive medication to relieve pain. 81. The most effective measure the nurse can use to prevent wound infection when changing a client's dressing after coronary artery bypass surgery is to observe careful hand washing technique. 82. For a client who excretes excessive amounts of calcium during the post-op period after open heart surgery, which of the following measures should the nurse institute to help prevent complications associated with excessive calcium excretion? Ensure liberal fluid intake. 84. Good dental care is an important measure in reducing the risk of endocarditis. A teaching plan to promote good dental care in a client with mitral stenosis should include instructing the client to do which of the following. Select all that apply. Brush the teeth twice a day, floss the teeth at least once a day, have regular dental checkups, and that's it. 85. Before a client's discharge after mitral valve replacement surgery, the nurse should evaluate the client's understanding of post-surgery activity restrictions. Which of the following should the client not engage in until after 1 month post-discharge appointment with the surgeon? Lifting anything heavier than 10 pounds. 86. 3 days after mitral valve replacement surgery, the client tells the nurse there is a clicking noise coming from the chest incision and the incision seems to be becoming larger. The nurse's response should reflect the understanding that the client may be experiencing which of the following. Anxiety related to altered body image. Let's see, 89. A client is taking clonidine for treatment of hypertension. The nurse should teach the client about which of the following common adverse effects of the drug. Dry mouth, hyperkalemia. Oh, sorry, no, not hyperkalemia. Dry mouth, impotence, and sleep disturbance. 91. The nurse is discussing medications with a client with hypertension who has a prescription for Lasix daily. The client needs further education when the client states which of the following. I know I should not drive after taking my Lasix. 92. In teaching the client with hypertension to avoid orthostatic hypotension, the nurse should emphasize which of the following instructions. Select all that apply. Arise slowly from bed and avoid standing still for long periods. 93. The nurse is teaching a client with hypertension about atenolol. The nurse should instruct the client to avoid sudden discontinuation of the drug. 94. The nurse teaches a client who has recently been diagnosed with hypertension about following a low-calorie, low-fat, low-sodium diet. Which of the following menu selections would best meet the client's needs? Baked chicken, an apple, and a slice of white bread. 96. An older adult with a history of hypertension is admitted with diagnosis of dehydration. The client is becoming increasingly confused and weak. The client reports taking 1 tablet of hydrochlorothiazide daily, and the prescription is written for half a tablet. The nurse should obtain additional information about decreased hepatic blood flow. 97. A client diagnosed with primary hypertension is taking chlorothiazide. The nurse determines teaching about the medication is effective when the client makes the following statement. I will, and it's select all that apply, take my weight daily at the same time each day. I will not drink alcoholic beverages while on this medication. I will reduce my salt intake, and I will use sunscreen if I have prolonged exposure to the sun. 98. Which intervention would be most likely to assist the client with hypertension in maintaining an exercise program? Tailoring a program to the client's needs and abilities. 99. The client realizes the importance of quitting smoking and the nurse develops a plan to help the client achieve this goal. Which of the following nursing interventions should be the initial step in this plan? Establish the client's daily smoking pattern. 100. When teaching a client about propranolol hydrochloride, the nurse should base the information on the knowledge that propranolol blocks beta-adrenergic stimulation and thus causes decreased heart rate, myocardial contractility, and conduction. 101. The most important long-term goal for a client with hypertension is to make a commitment to long-term therapy. 102. The client has had hypertension for 20 years. The nurse should assess the client for renal insufficiency and failure. 103. The nurse is developing a care plan with an older adult with hypertension as instructing the client that hypertension can be a silent killer. The nurse should instruct the client to report signs of which of the following diseases that are often a result of undetected high blood pressure. Cerebrovascular accidents. 104. A hospitalized client who is being treated for hypertension with Lasix, atenolol, and ramipril develops a second-degree heart block, Mobitz type 1. Which of the following actions should the nurse take? Withhold the atenolol. Let's see. The nurse observes the cardiac rhythm below, and it's like crazy. I don't know how to describe that. You check for a pulse. That's 115, by the way. 117. A client who has been given CPR is transported by ambulance to the hospital's ER, where the admitting nurse quickly assesses the client's condition. The most effective way to determine the effectiveness of CPR is noting whether the pupils are reacting to light. 119. During CPR, the xiphoid process at the lower end of the sternum should not be compressed when performing cardiac compressions. Which of the following organs would be most likely at risk for laceration by forceful compressions over the xiphoid process? Liver. This question is CPR should be at what depth? 2 inches. 121. If a client is receiving rescue breaths and the chest walls fail to rise during CPR, the rescuer should first reposition the airway. 124. A nurse is helping a suspected choking victim. The nurse should perform the Heimlich maneuver when the victim cannot speak due to airway obstruction. 125. When performing the Heimlich maneuver on a conscious adult victim, the rescuer delivers inward and upward thrusts specifically below the xiphoid process and above the umbilicus. 129. Which activity would be appropriate to delegate to a UAP for a client diagnosed with MI who is stable? Record intake and output. And 132. The nurse is tracking data on a group of clients with heart failure who have been discharged from the hospital and are being followed at a clinic. Which of the following data indicate the nursing interventions of monitoring and teaching have been effective? 5% of the clients require hospitalization in the last 90 days. 133. The nurse in the intensive care unit is giving a report to the nurse in a cardiac step-down unit about a client who had a coronary artery bypass surgery. Which of the following is the most effective way to assure essential information about the client is reported? Use a printed checklist with information individualized for the client. So that's it for Lippincott, and next I will do the rest of the Mosby's questions.